Good afternoon, Team Chesterfield. Welcome to our fifth in a series of 9 community town halls to discuss and seek public input on the reopening of schools in the fall of 2020. We appreciate you all taking time today to join us in this important conversation. Our school board members on the call today are definitely interested in getting as much community input as they face probably one of the most difficult decisions that they'll make in their tenure as a school board. They may have thought budget and calendars were difficult, but they haven't seen anything yet. That said, this is a very serious conversation and we do want to engage with the community on this topic. So we appreciate that you have joined us here today. I mentioned that this is the fifth in a series of 9. We have another one scheduled for tonight, and then we'll be back on board again tomorrow with 3 more tomorrow. So if you have not joined us yet or you want others to see this after, please encourage them to visit at another time. The town halls that have already been completed also are already posted on our website, mychesterfieldschools.com. and also exist on our social media platforms as well. Good afternoon. My name is Tim Bullis, and I lead the Communications and Community Engagement team for Chesterfield County, and I'm excited to be here today with our School Board Vice Chair and our Clover Hill District Representative, Dot Heffron, our Bermuda District School Board Representative, Ann Coker, our Superintendent, Dr. Merv Doherty, our Deputy Superintendent, Dr. Thomas Taylor, our Chief Academic Officer, Dr. Sharon Pope, and our Chief of Schools, Dr. Lisa High, and our newest team member, our Chief Operations Officer, Mr. Josh Davis. They'll be an integral part of this meeting later on as we get into the question and answer period. Just a brief overview of what we hope to attempt to tackle today. Ms. Heffron will bring some welcoming remarks and some reflections from the school board. And then she'll introduce Dr. Doherty, who's going to go through a modified PowerPoint. And I say modified because it has been slightly tweaked from what the school board received last Tuesday. You'll notice that we've added an additional option after hearing from both staff and families about some concerns that they had. So Dr. Doherty will go through that PowerPoint. Ms. Heffron and Ms. Coker will offer some reflections based on where they are at this point in time in this discussion. And I think it's important to note with that there have not been any decisions made, and there will not be at least until July 20th, which is a special called school board meeting to discuss this topic again. That said, I think it would be important for us also to acknowledge, and we can't say it enough, that we are in a very fluid situation and a very fluid time in society. And that July 20th decision will be as good as it is on that date. That means that if our country or our community changes in the course of the 2 months leading up to school after that, whether it means progressing forward into a yet unannounced phase 4 where restrictions are loosened, or we end up in Virginia, like some other states, retracting back into phase 2, then we'll come back together. We'll look at how those affect our options, and then we'll continue to dialogue with the community. But it's important for us to reach out to you all today. Yesterday in these sessions across our various platforms that we offered, we engaged over 50,000 people in this conversation. I had a rich conversation this morning and are looking to a rich conversation again this afternoon. So with that said, we'll turn it over to our school board vice chair, Ms. Heffron.
Thanks a lot, Tim. Good afternoon, and thank you for joining us for this important conversation. Today, Ann Coker, Bermuda District Representative on the school board, and myself, Dot Heffron, School Board Vice Chair and Clover Hill District Representative, welcome you to the second of 3 virtual town hall meetings that we're going to host together. The purpose of these conversations is to gather constituent feedback regarding Chesterfield's return to learn options, so that we can adapt a plan for the fall that best suits our students and their families, as well as for our teachers and our staff. Now, while none of us could have predicted the impact of this pandemic this past spring, Ann and I are very proud of our county's commitment to ensuring that learning continued, and we were especially impressed with how our central office staff and high school administrators worked so hard to create meaningful graduation ceremonies to celebrate our class of 2020. Going forward into the fall, we are confident that our outstanding team of educators, administrators, and central office staff will continue that excellence as they plan and provide an engaging learning environment for all of our students, regardless of what comes our way. Hearing from our community helps guide us through these tough decisions that we're facing. No matter what learning looks like in the fall, be assured that we are committed to our students, families, and employees. Now it's my pleasure to introduce our superintendent, Dr. Merv Doherty.
Ms. Heffron, thank you very much, and welcome everyone. Good afternoon. another opportunity for us to share information of our options and issues that we are dealing with, and also to take questions from information that we provide and give you information as we move forward. So our communications will stay as relevant and current as we can and as frequent as possible. So let's begin with our plan to look at the 2021 school year for Chesterfield County Public Schools. Today's agenda, Saffron already gave welcome remarks, overview for myself and acknowledgments, presentation on the options that we are currently considering, and the acknowledgement of the uncertain future. As you're well aware how rapidly things change, if not day by day, week by week, and an opportunity to talk about and answer questions from the community. So we in Chesterfield believe that all students should have face-to-face time every day. We want all of our students to return under normal circumstances, which we are not under right now. We know that returning to school too quickly will cause problems, and we want to make sure that we have a safe and healthy environment for students and staff. And we realize that our families who want to return to school, and then we have families that would prefer to stay home. So any decision we make, we know that we will not make everyone extremely happy, but know that we are looking at the safety and health of all people who enter our schools. Our school board is expected to vote on a school division plan for reopening during the special call board meeting on July 20th. Everything we know about that we're going to discuss to the point of the 20th really is a day by day, and even today as we speak, things could change by decisions and guidelines. So we are speaking moment by moment right now. And obviously these changes are going to affect what we do in phases, as additional phases may be entered in by the governor, and we will make sure that we communicate to you in a quick and appropriate manner. So we rely on the Centers of Disease Control and Prevention, the Governor's Office, the Department of Health in Virginia, the Virginia Department of Education, and the Chesterfield County Risk Management Team for information and the guidelines for health and safety. And our Chesterfield County Risk Management Team also works closely with the Chesterfield Health Department to get information. We review the executive orders, look at social distancing guidelines, and other health and operational recommendations. And as you know, today we entered phase 3, and 2 or 3 weeks from now, a month from now, there could be another phase or other guidelines that will help us with our decisions. But we wanted to make sure that we had input from our students and staff, our families and community members, by doing surveys and having additional surveys as the future to make sure we know the concerns, who will be attending, who may choose virtual education, for transportation are big issues for us, as you'll hear later. The variables for families, the choice, do you prefer in person, or are you going to choose a virtual format for educating your child? Our access is important for all students. That technology plus internet access is available to all of our students in Chesterfield County. I say that again, to all of our students in Chesterfield County, and we are working to make sure that that does occur as we start the school year. The operational flexibility that we have, as our example, the busing of students. We've seen the guidelines change from having 10 students on a bus to now 1 per seat, and we have no idea what the guidelines will change down the road. We also know that the executive order for the governor calls for face coverings while you're in public, and that scheduling from the different groupings that we have from families and options that we have will be an important measure for us, as well as the class schedules. So we know that the guidelines from the Virginia Department of Education will want to review our reopening plans. However, they do not have authority over what decisions are made. The authority to our final decisions as we open schools for 2021 will solely be based with the Chesterfield County School Board members. The state has encouraged us to make sure that with the that we talk with our local health agencies, look at the health conditions, make sure we understand community concerns, and importantly, that we look at the facility constraints from the buildings, classroom sizes, and transportation guidelines as we move forward. And that we know that the local boards may deviate from the VODE plans and guidance with health and instructional plans. So talking to our risk management team, we were looking for CDC guidelines, and they said that 50% capacity seemed reasonable, that we could follow the guidelines presented at this point in time. The Department of Labor will be providing workforce guidelines, looks like July 15th or 16th when they will come out. And that we know that our staff must certify themselves by self-assessment to make sure that they are well to come to work. We have cleaning of classroom guidelines in case COVID-19 case would occur, and that we would immediately notify people involved, make sure that we clean the room thoroughly, and have the ability to use that classroom again upon the completion of cleaning the room. Also, that we know that on the bus right now, if students go on the bus, they will have to wear a mask. But if they're family members, they may sit together. So some changes again that have occurred recently. While the options we reviewed with the school board last week included an option to bring back all students all at once, which was option number one, we are basically looking to err on the side of caution to make sure the health and safety for 63,000 students and nearly 8,000 employees will be followed by the guidelines. We recommended remaining in line with the social distancing guidance from CDC, VDH, and risk management. And the key for us when we're looking at the options is that the health guidelines are changing every couple of weeks, and we will continue to stay abreast of the changes and to look at our plans. So when we looked at our options, we thought about safety for our students and employees, the social and emotional well-being of not only our students but our staff, serving the most vulnerable students, making sure we have equitable access to resources, that we have flexibility in what we're looking to do and communication with everyone, that we understand the importance of looking at the loss of learning time, the recovery of learning time, and the opportunity to present new learning opportunities and content, and making sure that our staff have professional development opportunities and learning opportunities throughout the summer to prepare us for this coming school year. Our most vulnerable students, so we looked at the following groups of students will report every day face-to-face time is in session. All levels 1, 2, 3, and 4 of English language learners, and all level 2 adaptive curriculum students with disabilities. So the options, option 1, which on a normal day would have all students returning to school. Parents in all of our options, 1 through 5, can decide to send their children to school or decide to go with virtual coursework each day. Option 2, 50% of our students reporting every other day a staggered start and looking at odd even, so you may be on an odd day or even day. The opportunity here is that you would come on, example, on a Monday, your child would receive instruction of their schedule. Then on Tuesday, have work that was assigned by their teachers to complete, come back on Wednesday and hand in the work and be graded. And just for everyone to know, if you're in a virtual setting or in a face-to-face setting, our expectations for all teachers and students that attendance will be taken, grading will occur, work will be assigned, tests will be given, and all of our grading will be on the online format for review. Option 3 has a variation of coming 2 days a week, either Tuesday or Thursday or Wednesday or Friday, with a cleaning day on Monday, also individual student contact, and some professional development for our staff. The option 4 is similar, except you would come 2 consecutive days, either Monday, Tuesday or Wednesday, or Thursday or Friday, with Monday again being a cleaning day and contact day. The new option that was placed in there with as a modified option is that you would come on Monday or Tuesday with the cleaning day in the middle of the week on Wednesday, and then that Thursday, Friday doing the work from home. Option 5, 25% of our students coming 1 day a week, seems to be one that seems to be fading quickly due to the opportunities of changes in the guidelines for returning to school and amount of people that are allowed in public. And option 6, that we're preparing for virtual learning. If things happen like have occurred in other states where they reverted back to phases 1 or 2, where the governor would shut the schools down, we are preparing to make sure that we 100% of our students are prepared to do virtual learning with internet services. We would still do grading, still have attendance taken, and still be engaged in our students with new content. So at this point, we know that today we are in phase 3 of the governor with the guidelines, and that future phases could cause changes in capacities, could cause changes in recommendations, could cause changes in health guidelines. The most viable options today, and I say today as we speak, are option 2, 50% every other day, or option 4B, which would be 50% Monday, Tuesday, and then Thursday, Friday. So, Mr. Bullis, at this time, I will turn it back over to you, and we're looking forward to answering questions from our community.
Thank you, Dr. Doherty. We asked the community about a little more than 24 hours ago, actually about 48 hours ago, to send us questions in advance, and that we would also acknowledge that we would take them from our various platforms that we're broadcasting on. Ms. Coker and Ms. Heffron, we've got about 90 questions pre-submitted to go through. I don't know that we'll get through all of those. So what we've committed to doing is to putting together a frequently asked questions document at the end of these town halls that we will put on our website so that parents, families, students, teachers, and other staff can go through and get all the answers to the questions that they have if we aren't able to get through them all. The community has certainly responded with a great level of interest. Ms. Coker, Ms. Heffron, before we go any further, are there any reflections or observations based on the presentation Dr. Doherty just gave us?
Yeah, I think that we have, I'm really impressed with the number of options that we have. And I appreciate all of the work that's gone into this. And so what I'm hearing from Dr. Doherty is that we really are the most practical or obtainable solutions at this point based on where we are in guidelines and phases are options 2 and 4B. I'm looking forward to hearing what the community thinks, and I'm starting my list of questions and feedback as we go along.
Thank you, Dr. Doherty, for that presentation, and thank you to CCPS staff for conducting all of these town halls. It is very valuable to continue to get feedback from the community as we look at and navigate these various options. I too, as Dot just mentioned, am very pleased that we have all of these options to choose from, so that as situation changes, whether that's a month from now or 6 months from now, we have some options that we can go back and revisit and be able to turn on a dime. So over these next 3 weeks before the July 20th meeting, we will continue to get your feedback, answer your questions, and make sure that we're making the best decision that we can for all the students.
Thank you, Ms. Coker. And with that, we'll go ahead and start getting into the questions so we don't waste any time. One of the ones that has popped up within the last 5 minutes is from Melody, who has read the American Academy of Pediatrics recommendations that were released last Friday and is wondering how they will play into our decision-making moving forward. I'll start, and then I'll ask Dr. Taylor to jump in and talk about the variety of groups that we're relying on. I'll acknowledge that the esteemed panelists on this call today are experts in education. Many of them are doctorates in education. Very few of them are doctorates in medicine and have studied medicine, so we will be relying on the guidance of those leaders. First, for the American Academy of Pediatrics, they did issue some recommendations last Friday. This was done after our school board meeting on Tuesday when we initially launched the options that we had. We are waiting for some further guidance from the Virginia Department of Health and others who have given us the recommendations so far that we've been operating under. to see exactly what this guidance, which infers that students, doesn't infer, it says that students should be returning to school because of the stability that it comes with being in school from a mental health capacity, a social capacity, and an academic capacity. So we're taking that guidance from an association, which is not necessarily a regulatory agency like the Centers for Disease Control or some of the other groups that Dr. Taylor will talk about in a minute, but that is certainly something that we're taking as we're gathering guidance from everywhere. So Dr. Taylor, you can start us off by talking about who we're actually listening to when it comes to what's best and what's safest for our students.
Thank you, Mr. Bullis. And I'll even preface by saying one of the themes that our families will hear a lot from us, not only now, but and have heard from in the past, is that our number one priority is student and staff safety. We'd love to say that instruction is our number one priority. The reality is that's our number two priority, and that making sure that our campuses, both virtually and brick and mortar setting, are in fact safe places for students to learn and for adults to work. We are grateful for the American Academy of Pediatric Doctors of bringing forth their guidance. That is going to be a tremendous help to us. We are definitely taking that information in, but the folks that we're receiving our direction and our guidance and guidelines from actually come from our Virginia Department of Education and the Virginia Department of Health. The governor's office, when making guidelines for the phases that have come out, have consulted with the Center for Disease Control, which has a mandate of stopping the spread of this pandemic. And they have definitely worked with our Virginia Department of Health and local health agencies to create guidelines that make sense based on that guidance from the CDC. And what you can see as family members, if you want to go online and take a look for yourself, you can go to the Virginia Department of Education's website and look at their R2020 plan, which is the the statewide plan for schools to restart and recover learning. And it maps following the governor's phases for reentry on the specific guidelines that school systems should follow and maintain. One of the most significant of these guidelines is maintaining 6 feet social distancing. Well, obviously, given some of our constraints in terms of the size of our schoolhouses and the size of our school buses, maintaining that social distancing provides some challenges. So we are working to address those challenges while maintaining the safest learning environment that we possibly can for both our students and our staff.
Thank you, Dr. Taylor. I'm going to ask you to stay unmuted because I'm going to ask you a question that you can't answer, but we need to acknowledge we can't answer it right now. Stacy's asked what a phase 4 might look like and what the guidelines might be that might help us bring more students into school.
Yes, Stacy, the elusive phase 4 that hasn't been announced and doesn't exist yet. We don't know. And as Mr. Bullis alluded to it, we can only speculate. If we've learned anything from our COVID experience this spring, it's that we have to be tremendously flexible. When we reflect back on the early days of COVID and the middle of March and early part of April, there was a lot of information coming at us at a very rapid pace. And sometimes our guidance that was only just a few hours old would be outdated. And so it's important to note that one of the pieces that Dr. Doherty closed with in his presentation is that our recommendations right now are based on what a phase 3 opening would look like, because that's the guidance that we have available. As soon as the state, vis-a-vis the Department of Education and the Department of Health, come out with new guidance to support any additional phases, whatever that may look like, we will update our guidance and probably update our recommendation in terms of what we would recommend to the board as the best course of action. And it will be up to the board to discern where we actually go from there. Thank you for your question, Stacy. It's a great one.
Thank you, Dr. Taylor. As we talk about health and safety before we get into actual instruction, Cora has asked, how are schools addressing ventilation systems given past history? Being inside with poor ventilation is one main way that COVID is being spread. Mr. Davis, can you talk a little bit about what we're doing to maintain and sustain a clean, safe learning environment?
Yeah, that question is certainly not surprising, but our number one objective, as Dr. Taylor mentioned, is safety of students, and that means a healthy learning spaces. It means comfortable students and faculty. It means good airflow. So there's no doubt that recent history in regards to Chesterfield and HVAC has been a bit checkered. There was a period of time where preventive maintenance didn't take place, and we had some systems go down and not provide the comfort and ventilation that was needed. That has changed in the last couple of years, and I'll share a couple of things. First of all, we are getting some more major maintenance dollars and have been replacing systems at multiple schools. But that's going to take a while. I'm not going to say we've snapped our fingers and replaced all the HVAC systems at 65 schools. We haven't, and that's going to take a period of time and a significant investment. But we do invest in preventive maintenance. We've added that line to our budget a couple of years ago, and I'm happy to report that all 65 of our schools have had preventive maintenance services at least once, if not multiple times, in the last couple of years. All of the elementary schools were seen this past year, and we've got a new contract coming underway this summer. That preventive maintenance allows us to cut off some issues before they occur. We are changing filters more often. We're using some stronger filtration. We've made some repairs that have, again, hopefully taken care of problems before they turn into big problems. The question didn't include the Legionella bacteria, which surfaced in recent history here, but we've taken great strides to clean those cooling towers, to come up with more biological agents to ensure that they stay clean. We've got an active testing program where if we even see a microscopic, well below the threshold amount of Legionella, we can jump on it and clean right away. So our degree of confidence is higher. I'm not suggesting that we're not going to have any HVAC failures, and it's one of the things our staff is going to be on their toes and ready to support schools. We would certainly hate to close a building, but if we needed to because HVAC went down, we would. So we're staying on our toes. We realize there's various contingencies, but we have invested more in these activities, and we believe that we will have better ventilated, cooler, comfortable schools than Chesterfield saw 2 or 3 years ago. And thank goodness that process has begun in this COVID environment when you really, really need it.
Thank you, Mr. Davis. I'm going to keep you on the hot seat, so to speak. Jennifer has asked, what will be the procedures when cleaning protocols are not followed? I'm going to flip that around a little bit and ask for you to describe to the community exactly what it is that we're going to be doing. Okay.
Well, that's a good question, and the answer to that is inspection by supervisors and building leaders. But let's talk about what we are going to do, because I've seen some comments on Facebook, gosh, are they only going to clean on this day or that day? No, we're going to clean every day. And you see the term deep cleaning. Well, to us, deep cleaning means what our contract crews are doing in the summer when they really strip down the floors and prepare the school buildings kind of to be in brand new condition every fall when we come back. What we are going to do every day is vigorous cleaning. We have day porters, building operation supervisors that are going to be actively taking care of those high volume touch points at least 4 times a day. We're going to clean restrooms 4 times a day. Any eating surfaces, if we have eating taking place, multiple times during the day. And cleaning is everyone's jobs. It's going to be a bus driver's job. The teachers are going to do more cleaning, but the real responsibility is in those day porters and building operations supervisors that I mentioned that'll be in the school 5 days a week and on weekends if necessary if we have evening events and so forth. We have contract custodians, which are very, very valuable partners. They are in every building in the afternoon and in the evening to totally clean the building and have it prepared for the next day. If we find that there's some faults, we will take care of that and we will be observant. One of the things that Dr. Doherty and I have discussed is our higher leaders, our assistant directors, they're going to be out at school checking up and seeing where buildings aren't necessarily meeting our standards. We want teachers and principals and, of course, parents and students to let us know. If there's some question about whether an area has been disinfected or sanitary, let us know. And we'll keep records in terms of what we have accomplished and cleaned. We know that we're working with human beings here. We're going to have a little absenteeism, but we're going to put the resources in place to keep our buildings clean.
Thank you, Mr. Davis. That brought up a question from a parent who wants to know about whether or not we're going to be doing temperature checks on students before they come to school. Dr. High, Dr. Taylor, do you want to take that one?
Sure, I'll jump right in. And Dr. High, if there's anything I missed, please feel free to chime in as well. Right now, we do not have a policy in terms of requiring temperature checks upon a student entering the schoolhouse. However, we are going to ask parents that they do a health check and follow a protocol that we provide to ensure that their kids are healthy before getting on the school bus or entering the schoolhouse. We've received another question in some of our other town halls about immunization as well. And unless there is a state law that mandates immunization for COVID-19, well, right now there is no immunization for COVID-19. But should one be made available, we'd certainly encourage folks to do that. But until there's a state law that would mandate it, we would not mandate that as well, or make a recommendation to the board that they follow suit with that mandate.
Dr. High, do you want to continue on that conversation about what we will do with a student or staff member should they present symptoms in the school setting?
Sure. I just was trying to get unmuted. Sorry. So in terms of, safety and the welfare of our students and staff are our top priority. If a student exhibits symptoms, they will be removed from the space. They would go to our clinic, and we're considering having a kind of a sick side and a well side space for our students. They would go there and be spoken to with our clinic assistants. And then parents would be called to come pick up the students. While we're waiting for parents to come and pick up the student, we would keep the student away from other students where, there could be any exposure. We would definitely vigorously clean the area if there has been exposure and the student needs to go home. And then depending on the situation, we would determine what our next steps would be in terms of communication. We wouldn't necessarily give out the name of the individual for the HIPAA as well as FERPA, which is the Family Education Rights Privacy Act. So we need to make sure that we keep privacy of the individual, not disclose that information. But again, we would make sure that we clean the area and move forward. And if it's necessary to communicate broadly, then we would make that decision and let families know.
Thank you, Dr. High. I would tag on there that we also provided within the past 2 weeks a checklist for our staff members that they need to do a self-assessment before they come to work every day. And in the coming weeks, we'll be sharing that checklist with parents too, so that we can be partners in this. I know there's been some concern that sometimes parents, sometimes families, because of issues at home, need to send their children to school, and if they're not well at this time, then this is not the time to send them to school. So let's start to head into a little bit. I know we'll come back. Mr. Davis, you're not off the hot seat yet. I see a couple of transportation questions down below, but let's get into some instruction right now. And I think we need to start with the very basic one. When we're talking about being in school or out of school, Dr. Pope, can you talk about virtual learning and what exactly that is?
Absolutely. Glad to tackle this, and good afternoon, everyone who's joined us. I completely understand why our listeners, and sometimes even amongst our staff, we can get rather tangled up in some of the language that's out there these days when we hear terms like hybrid, parallel learning, and distance learning, and virtual learning, and online, and synchronous, and asynchronous, and remote. The list goes on. And depending which site you Google and check, you'll get different definitions for those words. I think what is most important for those listening and for our Chesterfield community is that we understand clearly within our school district what we mean when we use certain terms. The one that is coming up most frequently, I think, through our parent questions is that question of, can my child, if I elect to do so as the parent,
remain 100% virtual for fall instruction in 2021. And I think by reading the wording of the questions, what I am ascertaining is that parents are equating a child not coming back into a school building as a virtual learning experience. So let's go with that. If that's where our understanding is, I'm good with that. We absolutely, has already been stated, are offering to our families that option. We have a program already well established for many years that's been smoothed out, the CCPS online opportunity for secondary students. We're very well versed in how to manage secondary students who in the summer, for example, or during the school year want to take an extra class, doing so online, virtually, with a CCPS teacher there as a supporter, someone who will help manage goal setting and progress monitoring and checking in with students. That is the model we could offer our families of secondary students who wish to not have their student come back into our schools just yet. We are asking that parents will be making that decision, that it would be a 9-week to a semester commitment, because it's not easy to adjust staffing very quickly, and we feel that's fair to our employees and our students, that if that's a choice a parent wants to make, it would be a choice for minimally 9 weeks. We also want to offer that virtual opportunity for our elementary students. And we understand that a virtual learning experience for our elementary students would need to be structured a little differently than our secondary students. They're going to need more face-to-face check-ins with their teacher through the devices that we're providing. They're going to need to be able to have short bursts of screen time, because the endurance of a younger student to sit for hours at length or even an hour in front of the screen can be difficult. So the structure would be different. It would accommodate our younger students, mixing up that combination of connecting with teachers through a device and some independent work on some really fabulous learning apps that we've purchased. I have gone in and tinkered with them, and they're very fun and animated and game-like, and they work on the 5 strands of literacy, including phonics and phonemic awareness and comprehension and fluency and vocabulary, as well as basic math skills. So it would be a blending of those types of learning experiences, and we would again have a CCPS teacher supporting any parent who wishes their elementary child not to return to our building and continue learning 100% virtually, at least for the time being, when we start up this fall. Contrasting that model and that choice for our families, we look at those options that Dr. Daugherty just shared. All except the first option involved a blended experience where students would come back into our building for a certain number of days, and they would also be at home distance learning for a certain number of days. In that scenario, the same teacher that manages the students and the instruction in the classroom will also be the teacher that's pushing work home, providing assignments and monitoring, again, students' progress in some of these really great learning applications that we're going to be making available to all of our students on the days they're learning from a distance, from a home, a family member, or a daycare setting. And that's that more blended distance learning connected with face-to-face learning model that we're talking about in options 2 through 5.
Thank you, Dr. Pope. If you want to keep your mic on, I'm going to blend 2 questions and come right back to you. Natasha from the Bermuda district has asked for any of the options that include virtual learning. Do you foresee meetings such as they were at the end of the last school year, or will they be more structure and actual teaching during these times? So I'm going to ask you first to talk about what the expectations might be in virtual learning in the fall, and then add on to that, Sarah has expressed a concern that in the virtual learning environment, more responsibility falls onto parents. So how are we going to support that?
You packaged quite a bit there. You're going to have to guide me if I miss any portion of that, Mr. Bullis. But let's start with expectations. So we clearly know as educators, we want to continuously learn and improve. We would want all of our students to be continuous learners. Shame on us if we don't do a better job this fall than we did this previous spring. There were many lessons that we could learn, many points we could glean in order to improve. And one of those is the need for expectations. Clearly, students need and parents need expectations from the school system for attendance, for grades, and actually for some sort of formal schedule where students know the expectations and know when they're required to be online, synchronously connected to a teacher versus independently working. So those expectations will be very clearly outlined. As I mentioned in my previous answer, we're looking at that 100% virtual option for parents. That option will have those expectations. And we're also looking at this blended option with face-to-face and distance learning. And in that scenario as well, those same expectations will apply. So parents can count on us to be giving assignments, giving grades, having a set schedule, and having set clear expectations for our students. I think that will make a big difference as we move into the fall. I love that the question embedded that idea that parents hold more responsibility. There's more of a burden on them when students are partially at home or fully at home learning. And we recognize that, and parents have a part to play, the school system has a part to play, and those two parts come together and hopefully form a good partnership. We can make that partnership stronger in the fall by more clearly communicating from the school system side exactly what we need our parents to do, how they can best support, and how they can more easily stay connected to our school system. We heard very clearly from our parents that it was overwhelming to have teachers using a variety of ways to communicate. And our teachers had wonderful intentions, and so many of them did wonderful work during the spring. But we need to simplify this for our parents. We need to push all of our communications through our single district learning management system called Canvas. This coming year will be our third year with Canvas. We've had teachers jump on very quickly and become exemplars, and we have teachers that are just really now building those basic skills. But we're going to hold that expectation as a school district this coming year, that parents can go to one place, regardless of if their child is in elementary, middle, or high school, to receive communication, updates, progress reports, and to stay connected to what's happening in the classroom. I hope that will make it easier for our parents. Our teacher expectations, we're also shifting in that regard as well. We launched today, July 1st, a series of required professional developments for our teacher. And what these PDs are going to bring to fruition for us is that our teachers will all begin with a baseline of skills that include a good understanding of what distance teaching is, pedagogy, best practices, how to keep students engaged, how to use that Canvas learning management system for all of our communication and instructional delivery, as well as becoming familiar with some of the new and exciting learning products we've bought in anticipation of some virtual learning moving forward.
Thank you, Dr. Pope. Dr. Hyam, I'll come your way in just a minute with a question about daycare, but Dr. Pope, you're not off the hook yet. We've got some parents asking some questions about special education services on the chat features right now. Can you talk a little bit about how we will be supporting students with IEPs in this time, how we are right now, our support for ESY students, what it will look like in the fall, and can you reiterate those groups of students who will be coming to school either 4 or 5 days a week, depending on which option we choose?
Another three-part question. Thank you, Mr. Bullis. All right, let's see if I can get all of these. If not, please correct me or prompt me again. You mentioned ESY, which is an acronym, and in education we love to use acronyms. So that stands for Extended School Year. And we know that our IEP teams who each know their students well and the needs of those students, that those teams look at each child and determine which of our students with disabilities need the extended school year experience so that learning continues throughout the summer. All of our families with students that qualify for extended school year have been contacted, and they have been offered virtual extended school year learning opportunities for the month of July. Just as we've stated repeatedly in this town hall, we are excited to think beyond July when we can begin seeing our students more frequently and more in a face-to-face setting. But for now, extended school year is offered to our families. They've been contacted not only from a message that Mr. Bullis sent out, but also through the schools directly to offer that virtual learning service to continue. Beyond extended school year this summer, we know we have our recovery of learning that was open and free to all of our families who were interested in participating, and we had outstanding numbers, double what we've normally seen in the past at elementary, middle, and high school participating. And of course, some of our students with disabilities are taking advantage of recovery of learning through that option. When we talk about the fall and we think about what will we be able to do in the fall, very much like in the spring, we have to ask that question and look at our individual students. So that means every IEP team looking at a student's individual education plan. IEP, that's what it stands for in case folks don't know, and saying with this individual child's accommodations or modifications, what can we do in a face-to-face learning setting and what can we do in a virtual learning setting, and making any adjustments that are reasonable, that we can absolutely deliver and within the restrictions that have been placed on us. So that review will continue. One of the review questions we are looking at in case we do return and we have the social restrictions of distancing and mask wearing, etc., imposed on us is, will this child be able to adhere to those expectations? And how will that instruction be able to still be delivered within those restrictions? So IEP teams are examining that question. They will continue to interact with our families as we get closer in July to knowing what our exact model will be next year. I can't state it enough, though, that our entire team here in Chesterfield County, we have heavy on our hearts the needs of certain student groups that we consider more vulnerable, that we really, really need to get them back in our buildings as frequently as possible. And one of those, I think, question prompts you gave me, Mr. Bullis, was to review a little bit what was on Dr. Daugherty's slide 15. And that slide reiterated again that we want to get our English language learners, levels 1, 2, 3, and 4, back in our buildings. Every day our buildings are open as soon as we are open. And that could be in some of these models 4 or even 5 days a week. We also want to bring immediately back, for every day that we're open, our students with disabilities that receive level 2 services. And another way of saying level 2 services, we consider our students that are often in our self-contained settings and some of our special classrooms, IDP, DP being some examples. But again, we're looking at that with individual students and individual student IEP teams to make those decisions that are right for each child.
Thank you, Dr. Pope. You can catch your breath. I'm gonna right now. Mr. Davis, you're on deck. I've got a transportation question. A parent has reminded me that we need to get children to school before we educate them, but I'm gonna go to Dr. High first. Leosha from the Clover Hill District says she's concerned about a schedule that doesn't consider single family units. While she's selected option 4, she's concerned about a child staying home when she would normally be in school. What types of supports, specifically with the daycare community, are we looking at building so that we can continue that learning process for our students?
Okay. And we do recognize, that an alternate schedule does present challenges for our families, and we will do what we can to support in that. So we have identified the daycares that are providing care to our students to every extent possible. We will partner with them to provide information regarding programs, instructional information that might support them as they work with children during the day while they're in daycare. We're planning some professional development opportunities for our teachers. So those items we will share with daycare providers to assist them with some of the programs that our students may be accessing when they're at school. All of our students will have Chromebook access, so some of the programming that they use during the day may be a Edgenuity, or it could be Myon, or some of the elementary programs that we use. And so we will provide the same information that we would give to our teachers for training to our daycare providers as much as they will accept and accept our support.
Thank you. Dr. Hine, I'm going to stick with you for a second because you opened the door for me. You mentioned technology and referenced Chromebooks. Things are going to look a little different in the fall when we return, whether it's in person or whether it's mixed with virtual. And we may be the only school division, the largest school division in the country to do this, but we're going to move to a K through 12 or maybe even a pre-K through 12 one-to-one initiative, meaning every student's going to have a device. How is that going to help us moving forward?
Yeah, that's correct. We're currently already 5 to 12, and our 2nd through 4th grade students have received devices over the last few months. We're even going to work on getting pre-K devices for students. We believe that providing the devices will not only will we provide devices, but we're also looking at providing access to the internet through either hotspots or through Comcast Essentials. Dr. Daugherty has worked very closely with a lot of our community partners to provide funding to offset the cost of those. And so families will be able to have access to the resources that are online for them. The other piece that we're really focusing on is if there's a family who can't access the Comcast, then we will deploy the hotspots that we have available. I believe we've already deployed over 200 device hotspots, but we will continue to identify those families who need those and deploy the hotspots where necessary.
Thank you. And I think it's important for us to clarify that this device is a tool to use. There's no expectation that a child would be at home watching a screen for 6 hours a day. Is that right?
That is correct. We would not expect them to be on the computer. And really earlier before at the end of the school year, we provided some guidelines, for K-1 students. It may be where they're with a teacher doing a short conversation or a lesson, and then they may go off for 15 or 20 minutes and be on maybe one of the digital resources and then they come back and do some work. For our younger kids, sometimes just, doing an art project or having some paper to work with is really beneficial to them. So no, we believe that screen time must be watched. So we'll be working with our staff to ensure that we are not asking for students to be on for long stints of time.
Thank you. Mr. Davis, a parent aptly pointed out that we have to get the children to school before we can educate them. That means getting them either on a school bus or with parent assistance. Eric has asked, Aaron has, let me find it, Terry. Sorry, I'm going down the wrong list. Terry, are children going to get to and from school? Buses are overcrowded already. They won't be able to social distance on a bus unless very few students are on a bus at the same time. Can you talk about how some of the guidance has already changed in that regard and what our plans are to bring them in on buses and to encourage families to bring them in themselves, working collaboratively with the police department to ease traffic concerns as well?
Thank you, Mr. Bullis. The question is spot on. We have to get children to school safely, and the best way in the past would be by school bus. And I'm a big advocate of putting as many of our children on school buses as possible because that is the safest mode of transportation. However, that resource is going to be constrained this year. The initial guidance that we received from the governor's office was to maintain 6 feet of social distancing. It didn't take long for me to figure out that meant we could get a driver and maybe 9 kids on one of our large school buses. And those types of operations would not allow us to bring a sufficient number of children to school. As you've noted in some of these previous town halls, out of our 63,000, we typically transport 48,000 students. And the scenarios that we're looking at bringing in about 50% of the kids. Okay, so that tells us 30,000 kids a day, but we still need more capacity on the buses. Dr. Daugherty in coordination with risk management, asked about the concept of seating one child in every seat in a checkerboard pattern to maintain a small amount of social distancing. And our risk management shop has granted us the go-ahead to make that plan. Boy, what we really hope for, but I don't expect, is to have that capacity raised any higher. So we're doing some very serious planning now, looking at buses with one child per seat, with the inclusion of sibling pairs that could sit together. But so things are still going to be different. That's a load of 24 to 26 children, maybe 30 if you have some sibling pairs. And we're normally taking 60 plus kids on an elementary bus, 40 to 50 secondary students. So frankly, we are going to reach out and ask parents to tell us what is their request for transportation. Many parents have written to us saying that they so much want to get their children back in school, they are willing to drive when they haven't driven kids in the past. So we expect to see more of a split mode between the parent driving children, school buses taking children. I think we're going to see a few more walkers, but that's going to take a lot of planning and coordination. Staggered arrivals at school, perhaps a window of about 30 minutes for arrivals as opposed to 10 minutes for our buses to all drop off the elementary children. That's something that may be planned. We may plan from the beginning, so what we call double back routes, where let's say in an elementary school, a bus picks up its 20, 25 students farther away from school, drops them off, and then goes back and picks up another load that's much closer to the school. And so we hope to actually plan those things in advance as opposed to having it just occur on the spur of the moment. And the coordination with schools and for parent drop-offs is important too. They have given infrastructure in place in regards to sidewalks and drop-off spots. We're hoping we can analyze each school, find ways where multiple students and cars can be offloaded at the same time with staff members out there to assist. And it might involve having a different route through the parking lot that gets the many, many vehicles off the street and in a queue that might snake its way through a parking lot. I've seen schools that have implemented such and sent videos to parents. This is what it's going to look like now. That's certainly something we can do. And you mentioned our partnership with public safety and the police department. We're going to need their help in some of those schools. Midlothian Mill is a great example of one that's right on a major thoroughfare, and we're going to have some congestion. And it's going to be the toughest right at the start of the year till we get a routine down. So we're going to, again, plan as best we can with the limited bus capacity, hopefully getting input from parents. Parents should expect to give us that input, hopefully in very short order. And that's not going to be a commitment for 180 days because we know your circumstances change. But if you tell us you plan on driving your child, and we hope you can for a good while, but then need that bus transportation, you'll have the ability to tell us that too. So covered a lot of territory there. Is there anything that I missed, Tim, that you think I need to chime in on?
I think you did a nice job there.
All right, thank you. Big challenge, and we appreciate the opportunity.
Dr. Pope, the next question will go to you. It's from Cheryl in the Clover Hill District. Have we studied options universities used last spring for virtual learning? Are we aligned with them?
So I'm trying to understand Cheryl's question a little bit more. Have we studied how universities use their online learning formats?
Yeah, have we gleaned anything from universities that went online during the spring as to how we could better engage with students?
Well, I was actually teaching for 2 Virginia universities in the spring, so I experienced that firsthand as a professor with graduate and master's degree students. And I would say that very much what was done in that setting was very similar to the tools that we were using, actually identical tools in one of the university situation that I was in. And I would say that one of the differences that we have to note is that when you're talking about undergrad and graduate students versus a kindergartner or a 6th grader or a 12th grader, I think we need to understand that there will be some differences, primarily that level of independence that we would expect our learners to have the older that they get. So I think we glean from every example that we see, and I think we also glean from all of the reading that we've done. And I know at the central office level, we have piles of reading every day. We try to plow through on what are other school systems doing, what are universities doing, and what is the research saying as far as best delivery modes for instruction. So, we're all here to learn. We're continuous learners. And I would say, yes, we're learning every day from a multiple array of sources how we can do this better. I think probably the biggest guidance for us, though, is coming from our parents at this point of what do they need to have changes in for this coming fall to make this doable if we're forced down this road.
Sorry, my lights just went out and I lost my ability to read the paper. I'll be right back. There we go. All right, we are still live on YouTube and on the website right now. Facebook just kicked us off, so we're getting ready to reestablish there, but we'll continue with that. Dr. Pope, Ashley said, thank you for helping answer questions about special education. She's looking to know exactly what level 2 special needs means. Can we explain what students are in that level?
Dr. Taylor, I know that's one of the things that we consider from a staffing standpoint. Maybe you want to jump in for just the difference in staffing for that?
Sure. The VDOE several years ago made an adjustment to how they certify special education teachers, and the distinguishing characteristic is whether or not children are served in the adapted curriculum, which is in more of a self-contained environment, versus being a part of the general ed curriculum and being served in that general ed setting. So when we're talking about our level 2 special education students, these are students that are typically in a self-contained environment for a majority of their coursework. They're going to be in smaller settings and receive a lot more personalized attention based on the services that are identified in their IEP.
Thank you. Dr. High, Amy on our YouTube channel wants to know if there's any discussions about parents with children in different grades and how we might keep them all on the same day if possible. Can you help us with that one?
Yes, we have considered that, and for families, we will work on keeping family units together, regardless of whether they have same last name or not, because we do have some families who do have different last names. So we will create a schedule that if a family unit would attend the same schedule, whether it be alternate days or days in a row.
Okay, thank you. Let's keep going on that tangent if we can. Can a parent request which days they need to go for work purposes? And I can tag on this one, but how are we going to engage the business community so that they're aware of our plans?
Unfortunately, we won't be able to allow parents to pick which days, just because we need to be consistent so that it, because it has lots of implications for other departments, could be transportation, other departments in general. So we will, have a schedule, and that we hope will work for the families, but it won't be individual on a case by case.
Okay. And I'll tackle the communication with the business community. Our superintendent is actually presenting next Wednesday to the Chesterfield Chamber, and we understand that the return to learn discussion is key among what they would like to hear him give updates on next week. So we will be engaging the business community on the options that we're considering and how that might impact their work, because we do understand that parents have to get back to work to continue the economic rebound that we need to see. So yes, we will be involving the business community. We're doing obviously these new 9 town halls. We're also reaching out to our teacher groups. There will be some specific focus groups with teachers, with students, with parents. So we're trying to blanket the community to get as much feedback as we absolutely can. Bill from Clover Hill wants to know, has it been discussed if we would allow elementary students to return to school on a normal school schedule and leave virtual learning to the older middle and high school kids? Dr. High, I believe we actually did look at that, and what were the discussions there?
We did look at that, but due to staffing as well as spacing for our younger kids to be in either their building as well as the middle or high school buildings, it was very complicated because we don't have the number of staff that we would need to be able to divide them across the different schools, as well as the setup for school. in the middle and high school. They weren't conducive to what is needed for an elementary student.
Next several.
I was just adding, it is an option for every family to allow their student to be virtual. So if a parent chooses for a high school student to remain virtual, that is something that they could do.
Okay. Next several questions get into a little more detail about the academic day. Where are we looking at having lunches? Will we be able to gather large groups in the cafeteria?
Okay, in terms of large spaces, we are not looking at having students in large spaces just because of the social distancing. And we know that when students get together, they are going to come together, and it will be hard to maintain that. In terms of lunches, the discussion that we've had thus far is to have students walk through the line and practicing the social distancing. There was a conversation with being able to use a kiosk when students come in, so they don't have to punch in their numbers or anything like that. It would really be our cafeteria staff who would be monitoring and keying in information for students to get their lunch. So that would avoid all of the touch points that could potentially cause some spread there. But more than likely, students would return back to their classrooms to have lunch with their peers.
Thank you, Dr. Hyatt. Good news is we're back on Facebook. Never left YouTube or the website, so we apologize for those of you who dropped off on our Facebook page. You can see the complete coverage will be posted on our website. The two questions that you missed were Dr. Hyatt just answering the question about would food be served in the cafeteria, and then, gosh, I forgot the last one. We've done too many questions over the last several days. We're good. Go ahead.
I was going to say, it was the question Dr. Taylor took about clarification on level 2 special education.
Great, thank you. So if you want to catch those, we can replay those later. Dr. Taylor, Dr. High, we mentioned in the previous ones, and there's 3 or 4 questions here about 4x4 schedules. We acknowledge, and this is an anxious, uncertain time, and that rumors start to take foot. Are we moving to a 4x4 schedule next year?
Yeah, I'll definitely let Dr. High fill in any of the blanks, and we're happy to dispel this rumor, though we never want to neglect any good idea that comes forward and take everything off the table. But it's important to note that it is our intention to go with a schedule that makes it easy for us to pivot back and forth between a potential change in the learning environment, whether that be in a hybrid setting or whether that be in a face-to-face or a virtual setting. That being said, we also do want to provide our kids with an opportunity to take the classes that they signed up for and to take them in a scope and a sequence that they were planning on. So for what that means to us as parents and as educators is that means very little change to the scheduling that we are providing. So 4x4 schedule is not something that we are considering at this time. We will need to make some small modifications to the timing in the day, and it may not exactly line up with the minutes that kids remember from the fall, but the general focus of what their schedule looked like and the classes that they intended to take are what we're going to be focusing on, not totally transforming what their scheduling might look like.
Dr. High, I guess with Dr. Taylor's answer there, that Jennifer's question of fine arts and performing arts means that those are still in play as well.
Yes, our goal is to maintain as many aspects of the current school courses that we have now, as many aspects as we can, and ultimately to also make sure that students are able to stay on track and on pace for their next level, whether it's grade level or graduation.
Okay. Dr. Taylor, I'm going to come back to you real quick. Can you briefly, for those who aren't familiar with education lingo, define what a 4x4 schedule is?
Absolutely. For those of you who are wondering what a 4x4 is, a 4x4 is offering 4 classes on a block schedule and having those classes administered on a semester basis. There are definitely some advantages to that schedule where students only have to focus on 4 classes at a time, but one of the challenges being that some classes are best delivered over the course of a year. It definitely puts us in a box in terms of what we can provide in terms of AP courses, world language courses, skill-based courses like mathematics. So there is an inherent advantage to having those courses taught over an entire calendar year, yet one more reason not to make a fundamental change at this time.
Thank you. Dr. Hyde, Dr. Pope, Carmen wants to know how any of the proposed schedules will impact the Chesterfield Career and Technical Center courses that we offer.
I'm happy to take that. I work with our Director of Career and Technical Education, and I just want to stress that we have so many special student groups and special programs that we're looking at. Dr. Daugherty did a great job outlining 5 general options, and they are broad-reaching and for the majority of our students, but we must always as well stretch ourselves and stretch our thinking to take any of those options as the board elects to move forward with in July, and stretch them to see how will they work for some of groups such as dual enrollment students, our career and technical education students, our gifted center-based students, for example. With CTE in particular, if you know anything about the curriculum and the trades that we offer, you know that a lot of the instruction has to be hands-on. Culinary expertise, barbering, nail, all of those. It's really hard to deliver those through virtual platforms. And we are looking at adding courseware that's very specific for virtual labs, but it's going to be critical in our options. That just as we're bringing in our ELL and our level 2 special education students daily, we have to find a schedule that will allow our career and technical education students to come into our buildings and use our labs. Luckily, from a regulated standpoint, those class sizes are already very small, which makes this stretch a little easier for us. But we absolutely want to assure all of our students who've signed up for those phenomenal programs that we have solutions in the works. We have drafted different possibilities depending on which option we land on next month. And we are fully expecting to offer these programs and to have our career and technical education students be able to come into the Career and Technical Education Center and experience those lab experiences and those hands-on practicalities that they need to have. We know that our students are often pursuing credentials and certifications, as well as other forms to demonstrate their mastery, and we're not taking any of those off the plate at this point. We are still fully expecting to be able to deliver the instruction we need in order for them to reach those goals. So hang tight for a few more details coming out, but please know we're working hard on it and we're very optimistic.
Thank you, Dr. Pope. We've got about 20 more minutes left in this session. I only have about 80 more questions to get through. And we're going to leave time for Ms. Heffron and Ms. Coker at the end as well to chime back in. So I'm gonna really try and close up with 4 or 5 different points. We focused a lot on the supports for families and for students. Mackenzie wants to know, besides professional development, how are we going to support teachers through virtual learning and potential in-person learning opportunities?
So that's a great question, and one we've not heard before in our town halls. So we've talked a lot about those PD offerings and those expectations where teachers will show mastery of some basic skills to better prepare all of our teachers and all of our students to have great opportunities. The other thing that I cannot fail to mention is that we have a very unique position here called instructional designer. And we have an instructional designer this coming year for each school. In the past, some schools shared their instructional designer. That is a full-time employee at the school who has the expertise to assist teachers and students in all of those learning apps and in that learning management system called Canvas that we referenced earlier. That means wherever I am comfort-wise as a teacher, I have that person in my building, or if I can't, connect physically with that person in my building, I'll obviously always available virtually to help me through my question marks. So I think that's a fabulous resource that our teachers have. We also have to recognize that some of our teachers are already outstanding in Canvas, Edgenuity, and some of our other learning apps, as well as some of our central office specialists. So we have those layers of experts, colleagues who have shown that they know how to do what needs to be done to reach students, as well as specific employees hired for that work. So that network of support is there. It's just a matter of raising your hand as a teacher and saying, hey, I need a little help with this. No judgment. We want to help. And we want to be sure that every teacher is comfortable using these tools this coming year.
Thank you, Dr. Pope. Our last two questions before we bring our board members back in to see what they'd like us to address as we start to close out. The first one is probably going to be split between Dr. Taylor and Dr. High, and it has to do with sports, and I'm going to expand it to extracurricular activities as well. One of our Clover Hill District parents saw a story in the paper today about one of the private schools in the region starting athletic practices, and has asked when athletics might be back up again, especially with some of the recreational sports starting back up. So Dr. Taylor, if you can take that, and then Dr. High, if you'll tag on to that, other extracurricular activities such as band, choral competitions, even after-school clubs, what are we looking at for that in the fall? Dr. Taylor?
Thank you, Mr. Bullis. For those folks who aren't aware, we work with the Virginia High School League, which is the third-party governing agency that supervises interscholastic athletics and activities and the competitions that go along with those. The VHSL, or Virginia High School League, is responsible for supervising everything from debate and forensics to football, soccer, basketball, field hockey, and everything else in between. You can see it as a very encouraging sign that this fall they have put forward plans to the Virginia Department of Health to evaluate whether or not they can begin conditioning practices on the field this summer for a fall competition season. They are planning on moving forward with a fall competition season. And right now they are awaiting whether or not they have the authorization to move forward. We, as a member of the Virginia High School League, will move forward with the guidance that they are released to go forward with or not. So we are pending that authorization from the Virginia Department of Health, as are all of the member schools of the Virginia High School League. We imagine that this will involve some restrictions and some cleaning protocols that will also have to be involved. There's no surprise there. But we do anticipate that some fall conditioning could start as early as the middle of July. And that is what we are looking at, and it is very encouraging to get our kids back out and involved if that's something that they're interested in.
And as we shared earlier, our goal is to create a schedule that is similar to as the normal schedule. So if we can offer band and course and do it in a way that it will keep students safe, we will continue with that. And in terms of after school activities, again, based on guidelines that we've received in terms of the social distancing and all of those pieces, we will allow for clubs, but we will work really closely with the principals to help determine what those after school events would look like, and as well as the adult sponsors who support some of those programs.
Thank you, Dr. High. Dr. Taylor, the last question isn't really a question, it's just more of an FYI for parents. We realize that by the time children return to school, it's likely going to have been at least 6 months since they had face-to-face contact with folks. We're going to be just as concerned with the social emotional learning as we are about the academics and the math and the science. What are we going to do to prepare to receive children who we haven't seen for 6 months?
Something else that you'll hear frequently from us in Chesterfield County Public Schools is that we believe in a Maslow's before Bloom's philosophy. And if you want a little fun with Google, you can look up Maslow's hierarchy of needs, or a throwback to your high school or college psychology class, to know that it's important that we care for the physical and social emotional needs of our children before we address the academic needs, because we know that kids can't learn unless those physical and social emotional needs are met first. So with that, many of our constituents may recall that this school board adopted the most historic budget in the history of the school system this past year, that involved adding 100 special education teachers, nearly 40 ESL teachers, and an additional 60 counselors. This was pretty significant. Unfortunately, as COVID hit less than 2 months after the board adopted their budget, we did have a revised revenue projection, and that revised revenue projection came with it a contraction of $23 million in the budget. And many of those supports that we had added and fought so hard to add have now been pulled back. So what do we do now? Well, we know that our kids need these supports. In particular, they need mental health supports because of potential trauma that they've experienced in their time away from school, and just reacclimating to the school environment, whether it be in part or in full or not at all. Coming back to the schoolhouse may carry with it a ton of trepidation, and we want to be prepared for that. And we also want to get kids back on track for learning faster. So many of you have probably heard of the CARES Act or GEAR funds. These are two stimulus packages at the federal and state level that have provided additional monies for local school systems to put into play to recover learning and prepare for returning to learn in a safe environment. We've spent some of these funds on summer recovery of learning activities. We've spent some of these funds on personal protective equipment, and we've spent a lot of these funds on adding back into our budget school counselors, ESL positions, so that our kids that do have a high level of needs can come to a schoolhouse that has open arms and ones that can adequately care for our kids in their social emotional development.
Thank you, Dr. Taylor. I have a feeling our two school board members on the call today, Ms. Heffron and Ms. Coker, have received an email or two about school reopening over the past several weeks. Ladies, is there anything that we haven't addressed that you feel like you're hearing more often than others that you'd like for us to quickly address this afternoon?
Thanks, Tim. Yeah, one or two emails. I do have a few questions. I have one about lunches. When we're looking at our options to reopen with the 2x2 with the day in the middle, when I look at that, I see that students are out of school 5 days out of the building. What is the impact of that compared to an every other day schedule for our students who receive free and reduced lunch and who rely on that, on our school lunches? And I have full confidence in Pearl Taylor and her fantastic team who have really just carried the ball, getting our kids looked after this summer, or this spring and summer. Is there a plan in place, and how would either of those schedules impact that plan?
So I'll be delighted to answer that question. And thank you so much, Ms. Heffron, for bringing that up, because it's important to note for our families that we intend to continue meal service to families who need it. We are delighted and thrilled by our nutrition program. Over 1 million meals served this spring and into early summer. And we just know that we are helping families through this difficult time as our kids do need nutrition. And this falls into that Maslow's before Bloom's philosophy. They do need nutrition in order to learn well. So we have not settled on the exact methodology on how we are going to do this, but we are going to look at several options, one of which that's gained a lot of traction is providing some kiosks for students to grab additional meals on their way out the door when they do come into the schoolhouse. But we also know that folks still aren't ready to come back to the schoolhouse, and we may just have those kiosks available in other parts of the building or by other doors and in other locations, possibly by the front door, just to be prepared to serve much in the way that we did this spring and summer. So we are intent on continuing our service and intent on serving needs of our students that are eligible to receive that service, and we will continue to do that. We just haven't exactly nailed down precisely how we intend to do it.
Yeah, Ms. Heffron, I will tell you that our chief financial officer who oversees our food and nutrition services, while he's not on this call today, he's quickly texted in and said, we will get 5 days worth of food to people, ... regardless of the scenario. So that is something that they are working on as we speak.
Fantastic. I appreciate that. I have one more question, and it's in regards to flu shots. It's my understanding that we currently We promote and facilitate flu shots for our staff. Would that, I can't help but think that if we were able to eliminate the flu as the possible cause of flu-like symptoms, that we may have a more robust response from parents and staff if someone was experiencing symptoms. What is the outlook right now as far as being able to not only promote and facilitate, but to also maybe provide, possibly require flu vaccines? And would there be any possibility of a partnership with our Chesterfield Public Health Department in that initiative?
So I'll chime in with this again, and thank you so much for this question, because there's nothing like a global pandemic to remind everybody of the importance of public health. And the flu is kind of that constant annual threat that continues from year after year and is far more dangerous than many people give it credit. And we do need to be attentive to that. I would imagine that we will definitely increase employee, staff, and family awareness of flu resources. And if you can remember back to the early days of COVID, there was a temptation to conflate the two. And we definitely don't want that. We take both very seriously, and both have different treatment approaches. I'm not a medical doctor. I won't go into explaining any of that because I don't know enough to explain it. But the truth is that we will make as many of those resources available and as widely publicized as possible. We do have a partnership with public health in regard to flu shots every year. We do have them freely administered through our employee health program, and our employee network for health insurance definitely provides for this. But we will definitely make all known available resources publicized well in the community, because of it is important not to conflate the two.
Thank you, Dr. Taylor. And I guess I just have one more comment, and that is to thank all of you at Central Office. Bringing this together on such short notice. I know all of you were working 24 hours all weekend. I saw all the emails. I know that this was a huge lift, and I appreciate all of your work in putting together this important conversation. And I want to thank the members of our community who submitted some really in-depth, thoughtful questions, and have given us a lot to consider as we move into this challenging part of our decision-making process. So I really appreciate everyone's engagement.
Thank you. I just have a one question, and it is related to the bus service and cleaning in particular. So yes, Josh, this would come directed to you. Just curious, especially if we have double backs or things of that nature, what is the cleaning going to look like, and as far as getting the buses prepared in between shifts?
So, nice question, and it's one, there may be some varieties of opinions. We did chat with risk management about transitions, because classrooms are going to have transitions also, especially at the secondary level. And we talked about the bus transitions, the buses doing multiple runs in a morning and an afternoon. And the take was that we should be okay to clean those buses with the sanitizer twice a day, at the end of the morning runs and at the end of the afternoon runs. But to try to do them between each load of students is not practical, nor in the view of risk management required, given the shorter amount of time. And I'm not here to say that we have all short bus rides, because we don't. But they felt that even, again, a high school student staying in a classroom for one period, that we don't need to sanitize the classroom before the next class comes in. So similar types of situations. So that's the timing of it. The method is, as I chatted a little bit this morning, is we expect all of our drivers to be, issued some disinfectant with a sprayer that will hopefully be sprayed on all the surfaces of the bus with a a cure time of 5 to 10 minutes. But again, that would be at the conclusion of their operations in the morning and in the afternoon. Perhaps a little bit of wiping down on the rails and so forth that are truly the high touch areas, and similar to what we would do at the door of a classroom. So I hope that's an adequate answer at this point in time, Ms. Coker.
Yes, thank you. Thank you very much. I guess I will go ahead, Tim, and move to the
Sure.
closing. Again, thank you to CCPS staff and all of the behind-the-scenes technology staff for putting together these town halls. I hope you have found them very helpful and informative. Dot and I thank you very much for attending today. You have provided some great feedback, as Dot mentioned, and questions, and we've had some good conversation here. As a school board, just wanted to share this little fact is we have 15 kids that are in CCPS. So as parents, we completely understand the position that everyone is in, as we are also facing these same challenges. But as a school board, we need to be able to step back and look and be able to make the best decision for our students and our staff and our parents. We want to get back to a normal school setting as soon as possible, but first we must be able to take the steps now in order to make sure we can return to normal sooner rather than later. I do wish that there was a clear and easy answer, and we had an easy solution to the situation that we are in, but we are examining all the facts. We are gathering all of your feedback, and we are going to make adjustments as quickly as we can in order to mitigate any educational gaps or navigate what the return to learning will look like. So please continue to share with your friends and neighbors about the remaining town halls that we have. We want to hear from everyone and continue this dialogue. You will also see some surveys coming out as we fine-tune the return to learning in the fall. And once again, we thank you for your participation and have a great day.
Thank you, Mrs. Coker. Just a friendly reminder, as she noted, we have 4 town halls left. We'll be back in front of the Bermuda and Clover Hill District again as well tomorrow. If you have missed any part of these, or you have friends who are looking to watch them, or staff members, and have not been able to access them or will not be able to make one tomorrow, we have all of them posted on our website as well, and the presentation is out there as well. Ms. Coker, you went down a trail that I'd like to close on too, if we could, and that's thanking our parents and our staff for everything that they've done over the last 3 months. I know that none of our teachers signed up to teach from home to kids at their homes, and so it's been a crazy time for them, and they've done a wonderful job. And a special thank you goes out to our parents as well. They didn't sign up to be part-time teachers either, yet they've accepted that responsibility graciously. And as we move forward, we would ask that everybody work with us with patience and grace. Our school board members have a tough decision in front of them, and I don't think anybody envies them at all. So with that, we will sign off. All the information again is on our website, mychesterfieldschools.com. As always, we appreciate your support. Have a great afternoon.